Hello dear guys, topic of our lecture: gingivitis in children, etiology and pathogenesis, clinical cases, diagnostic, differential diagnostic, and principles of treating gingivitis in children. Prevalence of gingivitis, please look on this picture. 7 years from 16 to 55%, 10 years 69%, 12 it is 77%, and 87 from 15 to 17 years. So very low prevalence of gingivitis in children. Classification of periodontal diseases. First group, it is inflammatory, Papillitis and gingivitis, and form of these diseases: catarrhal, hypertrophic, ulcerative, necrotic, and course it is acute, chronic. Depth can be marginal, alveolar part of the gums, osteoporosis of the cancellous substance of interdental bone septa. The prevalence of the lesion is it can be limited or generalized. And second group, it is dystrophic, atrophic gingivitis, and papillitis. Risk factors for periodontal disease. First of all, it is supra and subgingival calculus, crowding teeth, violation of occlusion, abnormal tooth placement, short frenulum of lips of tongue, mouth breathing, and crown and root caries. And at the end, poor feeling and orthodontic apparatus. Should be considered the prevalence of systematic diseases, diseases of the blood system, diabetes, the presence of cult, of infectious and viral diseases, allergic reaction, hereditary diseases, and hormonal disorders during puberty. And second, it is the use of drugs that cause changes in the periodontal tissues. And periodontal status, examination of the gums. We should look to color, volume, configuration, level of attachment, the presence and determination of the depth of the periodontal pockets, the nature of its contents, the state of the level of oral hygiene, and of course X-ray examination for differential diagnostics. And gingivitis is inflammatory process in gingival mucosa, and which isn't it accompanied with the loss of integrity of the dental-gingival attachment. And catarrhal gingivitis in children. Catarrhal gingivitis has a chronic course in most cases. Acute catarrhal inflammation of the gingival mucosa usually occurs on the background of acute infection diseases. Gingivitis can be localized and generalized. The localized process affects the gingival mucosa in the area of 3 or 4 teeth. 3 or 4 teeth only. Depending on the intensity of the clinical symptoms, we can distinguish mild, moderate, and severe degree of the disease. Mild form of gingivitis is characterized by affection of only gingival papilla. Gingival papilla and gingival margin are involved into inflammatory process. In case of moderate form of the diseases, and severe degree is characterized by affection of entire gingival mucosa and including the alveolar part. Clinics. In the case of acute catarrhal gingivitis, signs of exudative inflammation are typical. So children complain of pain, of burning, of swelling, and bleeding of the gums. especially when they eat hot meal. Objectively, examination defines swelling and bright hyperemia of gums mucosa. As a result of swelling, the relief is changed, and gingival papilla gets a dome shape. So palpation reveals pain and bleeding of gums. X-ray changes in the bone tissues if the alveolar process are absent. Children with a chronic catarrhal gingivitis complain of discomfort, rarely of insignificant painfulness of gums and sense of tension. Patients are also noted gingival bleeding during toothbrushing or eating of hot food. It should be noted that in children, the chronic catarrhal gingivitis can have an asymptomatic course or have unexpected symptoms. For example, periodic gingival bleeding during toothbrushing, practically does not disturb the child. The objectively examination can reveal the influence of local factors of the inflammatory process, for example, the presence of hard or soft deposits, caries, cavities, poor quality fillings, or anomalies of the attachment of soft tissues and malocclusion. In such cases, the gingivitis more often has the localized character. Generalized chronic inflammatory process usually occurs on the background of somatic diseases. Patients with chronic catarrhal gingivitis usually have insignificant swelling and hyperemia of gums with cyanotic shade. There is also a change of the gingival margin relief in the form of roll-like thickening. And soft plaque on teeth can be seen more often than dental calculus. So, objectively, criterion for detecting inflammatory in the gums, it is test of Schiller-Pisarev, and the severity of chronic catarrhal gingivitis is assessed using the PMA indices for the gingival and index Silln's law. And PMA index, papilla marginal alveolar index, modified by PARM. Up to 30% it is mild gingivitis, from 30 to 16 moderate, and over 16 it is severe gingivitis. And exudative inflammatory process of the gums, which proceeds without violation the integrity of the epithelial attachment and arises as a result of action of unfavorable general and local factors. By localization, it is divided into localized and generalized gingivitis, and acute chronic exacerbation, and mild, moderate, and severe. Acute localized catarrhal gingivitis, so it is acute trauma to periodontal tissues, and of course this mechanical trauma, chemical, thermal, and complaints. For example, it is pain while eating, and objectively it is hyperemia, swelling of the gingival papilla and the marginal edge of the gums in the area of one or more teeth, and bleeding of palpation, soft plaque. There are no radiological changes in the bone tissues of the alveolar bone. And papillitis, please look, only one, and here. Acute generalized catarrhal gingivitis in children, though etiological factors often occurs against the background of acute infection diseases. It can be and infections or some allergical reaction. complains this violation of the general conditions and which is associated with general somatic pathology, weakness, fever, headache, and pain while eating, bleeding, possibly an increase and soreness of the submandibular lymph nodes. Acute catarrhal gingivitis. Look to this case, please. Treatment of catarrhal gingivitis in children is identifying the elimination of etiological factors where necessary and treating them underlying diseases. So you should know about one of variant of catarrhal gingivitis. It is desquamative gingivitis, which appears more often in girls in the prepubertal and pubertal periods. Children complains of pain, burning, and significant gingival bleeding during tooth brushing. Desquamative gingivitis is clinically characterized by bleeding, by swelling, and expressed hyperemia of gingival margin and sometimes of the alveolar gums. The gingival mucosa gets naked look because of the continuous desquamation of the superficial epithelial layers. And treatment of catarrhal gingivitis in children, first of all, it is professional hygiene of oral cavity, then antibacterial therapy, so antiseptics, drugs of the nitroimidazole group, and the third group, it is anti-inflammatory therapy, so non-steroidal anti-inflammatory drugs, and physiotherapy, of course. Hygiene education, control of hygiene skills, recommendation for choice of hygiene equipment and products for dental hygiene, elimination of local predisposing factors, so necessarily to treatment of caries, correction of anomalies, for example, and treated of soft tissues in the oral cavity, support in therapy every 3-6 months. In case and consultation, the treatment is with pediatrician or other specialties. And professional oral hygiene in case of gingivitis in children should be provided gently to avoid injury and of gingival mucosa, especially in the case of acute course or aggravation. It is advisable to use application of local anesthetics, for example, 10% of lidocaine gel or a chemostat gel before procedure. In such cases, the removal of supra or subgingival deposits and is recommended to perform using hand or ultrasonic scaler without the use of end brushes. And for removal of the soft dental deposits, we can use 3% of solution of hydrogen peroxide. Also uses solution due to the ability of highly foaming, this cleaning mechanical effect. And besides it, hydrogen peroxide has also disinfecting and deodorizing and hemostatic properties. Of course, professional oral hygiene should be combined with the use of antiseptics, and chlorinated antiseptics have the most effective antibacterial action, such as chlorhexidine, triclosan, miramistine. They are used for rinses and for irrigation of the gingival pockets in oral cavity. And next form, it is chronic localized catarrhal gingivitis. Etiology factors: unhygienic state of the oral cavity, different anomalies, and dysfunction of chewing, unsigned oral cavities, small vestibule of the oral cavity, short frenulum of tongue or of the lips, and hypodynamia of the dentition, and lack active chewing. Chronic generalized catarrhal gingivitis and some etiological factors, local and general. Local, it is unhygienic state of the oral cavity, and general, it is somatic diseases in the child, and complaints slight pain of the gum, swelling, bleeding, bad breath. Chronic catarrhal gingivitis of the background of multiply caries and its complication. Look, please, and here. Differential diagnosis of chronic catarrhal gingivitis, of course, with periodontitis. We will have radiological changes, a sign for osteoporosis and initial resorption of the tops of the interdental septa, expansion of the periodontal gap in the region of the marginal part of the periodontium, and later the appearance of periodontal pockets as a result of disruption of the integrity of the epithelial attachment of the gingival sulcus, and hypertrophic gingivitis, connective tissues hyperplasia. Principles of treatment, of course, is caring professional oral hygiene and training and controlled tooth cleaning, providing advice of hygienic oral care, and sanitation of oral cavity. Anti-inflammatory therapy, so some herbal remedies, it is flavonoids. For example, chamomile flowers, bilberry fruits, or serpentine, mesomes, so preparation of the nitrofuran series. Physiotherapy treatment, hydrotherapy with carbon dioxide for 10 minutes every day or every other day for a course of treatment from 10 to 15 sessions, and electrophoresis of 1% solution of helascarbine or 5% solution of ascorbic acid with 1% solution of nicotinic acids, and phonophoresis with aloe, massage, hydromassage, and desenalization. Hypertrophic gingivitis is a chronic inflammatory process with accompanied with reactive proliferation of fibrous elements of the connective tissues based and basal cells of the gum epithelium. Hypertrophic gingivitis mainly has a chronic course in children, and its aggravation and remission are diagnosed too. There is 3 degrees of hypertrophy of the gingival mucosa. And for example, first degree, it is increase of the gingival papilla is less than 1/3 of a height of the dental crowns, and 2-degree gingival papilla overlap of dental crowns of 1.5, and 3 from 2 and 3 of the dental height. And clinics, in the case of granulation form of hypertrophic gingivitis, children complains of enlargement and painfulness and bleeding during brushing or eating of hot food. Swelling, hyperemia, and cyanosis of vestibular surface of the gingival mucosa are objectively determined. And gingival papilla are increasing size, loosened, have rounded or irregular forms, easily bleed even at insignificant irritation. The intensity of bleeding depends on the degree of exudation component of the inflammatory process. It is also notes the irregular scalloping of the gingival margin, especially in the case of hypertrophy of 2 and 3 degrees. As a result of hyperplasia, the swelling of the gingival mucosa, false pockets are formed, and their depth depends on the expressiveness of proliferative changes in the gums. The integrity of the dental-gingival junction is preserved. However, on the background of hypertrophy, even during accurate probing, is not always possible to determine initial signs of loss of attachment. In such cases, for differential diagnostics, it is necessary to provide the X-ray examination. Chronic generalized hypertrophic gingivitis and aggravation of granulation form of hypertrophic gingivitis is characterized by increasing of hyperemia, swelling and bleeding of the gums mucosa. In the case of fibrous form of hypertrophic gingivitis, children do not complain, especially at mild degree, or complain of an initial look of the gums because of its overgrowths and changes of configuration. Colors of gingival mucosa is not changed, so pale pink gingival papilla are enlarged and dense, painless on palpation, and have no signs of bleeding. And fibrous form, so objectively the marginal edge is pale in color, yes, and so treatment of chronic hypertrophic gingivitis depends of the etiological factors, clinical forms, and course of the disease, and also of the degree of hyperplasia of the gingival mucosa. So, treatment, also professional oral hygiene, antibacterial therapy, antiseptics and drugs, and anti-inflammatory therapy, sclerotherapy, so biogenic medications, herbal or other medication, depending on the degree of hypertrophy, physiotherapy, and hygiene education, hygiene control, hygiene recommendation, removal of local predisposing factors, and therapy every 3-6 months. Of course, consultation and treatment at pediatrician and other experts. So, increased content of nucleic acids in the epithelium and the connective tissues under the epithelium. Granulation form, of course, includes first of all removal of non-mineralized and mineralized dental deposits to avoid injury of enlarged gingival papilla. Do not use the end brushes, and removal of supra and supragingival and subgingival deposits should be performed with hand or ultrasonic scalers. And pathomorphology, it is granulation form. Severity, first slight, second medium, and 3 severe. So their gums covers from 1/3 of the crown of the tooth and 1/2, and more than 1/2 of crown of the tooth. Hypertrophic gingivitis, grade 2nd hypertrophy. Look, please. And here, grade 3. Differential diagnosis of chronic hypertrophic gingivitis, so periodontitis, also of course X-ray changes, signs of osteoporosis, initial resorption of the tops and interdental septa, expansion of the periodontal gap in the region of the marginal part of periodontium, and periodontal pockets. Catarrhal gingivitis, pain, of course, hyperemia, swelling of the gingival papilla and the marginal edge of the gums in the area of one or more lens teeth, bleeding of palpation and soft plaque. Fibromatosis of gums, so history and clinical finding, diffuse gingival overgrowth that begins in early childhood. And treatment, of course, is non-steroidal anti-inflammatory drugs. For example, 0.1% solution of methionine sodium salt, 5% it is betadine ointment, and 3% it is ointment acetylsalicylic acids and natural antibacterial drugs. Astringents facilities vegetable origin, hemostatic helicarbine, felicities normalizing tissue, gastric sense and metabolism of periodontal tissue, sclerosing drugs, necrotizing ulcerative gingivitis, so inflammation of the gums with predominance of the alternative component. Violation of tissue integrity, their necrosis. About etiological factors, so general and here decreased body reactivity due to hormonal disorders and diseases of the gastrointestinal tract, diseases of the central nervous system, acute infections, avitaminosis, allergic conditions, disease of blood, stress. So in the etiology of the disease, the leading role belongs of Fusospirulli symbiosis, so Fusobacteria and Spirochetes, and so local it is microbial plaque, turtle, sharp edges of the caries cavity, overhanging fillings, incorrectly designed or incorrectly fixed orthodontic appliances, and mechanical injury, crowded teeth, and bite pathology. So mild severity, also hyperemia and edema of the papilla, necrosis the tips of the papilla, gingival papilla are ulcerated, covered, dirty gray bloom, and painful and bleeding. So regional lymphadenitis and temperature. So clinics, typical symptoms of the diseases, it is prodromal period, so from 1 to 2 days. I increase the body temperature from 37 to 38 degrees, and headache, loss of appetite, sleep disturbance. So signs of acute catarrhal gingivitis are diagnosed. First of all, it is swelling, it is hyperemia, bleeding of the gingival mucosa, and later of the background of expressed catarrhal changes. It can be necrosis of gingival papilla and gingival margin appears. So children complains of the severe pain and bleeding of gums, increasing during food intake, and pottery smell from the mouth, excessive salivation, and increase of the body temperature. So the disease's beginning is characterized by attention of the gums mucosa in the area of 1 to 3 tooth, and this which corresponds of the mild degree of the diseases. So, and sometimes the disease begins with destruction of retromolar areas and palatine tonsils. And the general condition in these patients significantly disturbed due to considerable increase of body temperature. Diagnostics, so anamnesis, laboratory tests, complete blood count of, and test Schiller and PMA index. Differential diagnostic with gingivitis and periodontitis. Leukemia and periodontitis. Leukemia is swelling of the gingival papilla of the oral side. The process quickly spreads to other areas. The necrotic process prevails, which is not amenable to local treatment, and periodontitis X-ray changes. Catarrhal gingivitis is pain, hyperemia, swelling of gingival papilla, and marginal edge of the gums. And fibromatosis of the gums, history and clinical finding. And local treatment, anesthesia, yes, enzymes, because patient have a plaque, antiseptics, antibiotic therapy. So we should do in anesthesia, and then we should remove all necrotic tissues. Okay, it is called enzyme preparations, and then antibacterial therapy, anti-inflammatory therapy, and stimulation of regeneration. Then it is hygiene education and removal of local predisposing factors. Local therapy is aimed at elimination of conditions contributing to the development of fused spirally infection by removal of necrotic tissues and dental deposits, and by prescription of antibacterial medication active against the anaerobes. And average anti-HIV power, so steroid anti-inflammatory drugs, prednisolone, dexamethasone, and biogenic stimulants. It is levamisole and lysobact. And general treatment, so a large amount of fortified drinks, protein, easily digestible diet, and vitamins, different complexes, non-steroidal anti-inflammatory drugs, Panadol, nimesulide, and antihistamine by mouth. So, for example, Tavigil, Suprastin. Detoxification therapy and antitrichomonas drugs, broad spectrum antibacterial drugs, taking into account the sensitivity of microflora, and atrophic gingivitis. It is a dystrophic process, so here also we should look please on the neck of this. So we should treat these diseases with surgery and with local therapy. So local therapy, of course, it is oral hygiene, it is vitamins complexes, it is of course antibacterial drugs, and then we should work with the surgery. Thank you for your attention. Also wait for your synopsis, and have a nice day.